In contrast scan diagnostics, say this is the CBCT of the patient that you had requested. The area of interest is the upper right 4, 5, and 6 region and the lower right 6 region. Now we can see that we only have placed two implants in the upper region. We are going to first measure each and every aspect, and then we're going to tell. So there's two teeth in immediate extraction. As you can see, we do have a endodontally treated tooth. Restoring it is not going to be very difficult. My apologies. So restoring it is going to be difficult, but it will require a post and a core and a crown. But if it is extracted, an immediate implant can be placed. Or however, we would definitely recommend a delayed implant approach in this region. When we move on to the region of the 6, so this is where we've got very limited bone structure. So a lateral window sinus lift is definitely advisable. If we can show you, we've got 4 mm of bone height with approximately 7 millimeters of bone width. So you will need another 4 millimeters of expansion into the sinus, and hence we would highly recommend that a sinus lift from a lateral window approach should be done here. When we move on to the lower right 6 region, we've got adequate bone. We've got just below the crest, we've got 5.1 mm of bone width with approximately a good 14 millimeters of bone height. In this region, because there's a narrow ridge, we would advise that the implant is placed much deeper for better bone support and more longevity of the implant. Now we have placed all 3 of the implants for our doctor, and those implants look something like this. So we've got one implant in the lower 6 region. It is placed quite deep but has good bone support overall. We've placed in one implant in the upper 6. This is an 8.5 mm implant, but you can see that a sinus lift will be required to support this implant, and the other implant that we've placed in is approximately in the region of the 4 and the 5. And here we've got good bone support, so this can even be done immediately as well. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much. It's going to be slightly deeper as well. Thank you very much.